Hello, I'm Dr. Sharum Sharif. I'd like to talk about the homeopathic management of common infectious coughs today, during both the acute phase as well as the post-infectious phase, i.e., subacute or chronic coughs. Here's my bio. Here's a disclaimer for you. So, homeopathy has consistently proven to be effective in treating various coughs. It often succeeds where conventional medications or other therapies, such as herbs, nutrients, and acupuncture even, fail. In this presentation, I'm going to be focusing on infectious coughs, addressing acute and post-infectious coughs, um, and chronic coughs. So we're basically just going to cover them all: acute, subacute, and chronic. And I'm just referring to subacute and chronic coughs as post-infectious, because once you have the acute infection and you go beyond, coughing beyond a few weeks, then you're going into the subacute phase. And if you go, let's say, beyond 2 months, then you're basically talking about chronic coughs. We're going to cover them all. And the post-infectious phase has become especially significant since the onset of the COVID-19 pandemic, as acute coughs increasingly transition into subacute or chronic coughs. We will not be discussing non-infectious chronic conditions like GERD or asthma, or coughing due to, say, congestive heart failure. It's just a book that compares the results of homeopathic and conventional treatments of epidemics going back decades. It's a wonderful resource that can show you how effective homeopathy has proven itself to be for numerous epidemics. So, shockingly, a number of my colleagues over the course of the pandemic, and they have shared with me how they just don't feel comfortable treating acute coughs, acute and semi-acute. They might tackle chronic coughs, but when it comes to acute and semi-acute, they just don't feel comfortable. A lot of them, and they just refer those patients to urgent care. Or they prescribe conventional treatments such as antibiotics and cetirizine, inhalers, guaifenesin with codeine, and you name it, prednisone. So we just basically becoming more and more, our therapies are becoming more and more similar to what conventional practitioners are prescribing. And I believe there are obvious reasons for that. As I mentioned earlier, other natural therapies like herbal medicines and nutritional supplements, they just don't seem to be powerful enough to really take care of these cough patients, especially if I'd say for the subacute phase, when the cough is going beyond 3 weeks and it's going up, say, 3 weeks up to 2 months or beyond. It just doesn't seem like our colleagues are getting, I guess, good results. So they're just referring these patients out to urgent care. And some of these colleagues have years of experience or sometimes decades of experience. I'm finding that homeopathy is effective for just about every single case of cough that I see. It doesn't matter how long they've been coughing. So that's what prompted me to want to share my findings with colleagues. So I wrote an article that was just published in NDNR not long ago in February. You can refer to that. This presentation is significantly more extensive than the article, but the article, you might find it helpful. There's a couple of charts in there that you might enjoy having. And I wrote a blog on the subject that's also, I would say, is slightly more extensive than the NDNR article. And the blog is on my website, drsharif.com. I just keep hearing about people in the society struggling with all kinds of coughs. Just you probably have heard that the Pope was recently struggling with bronchial crisis and pneumonia, and it made the news, of course. And Children's Health Defense put out this interview with Dr. David Brownstein on how to tackle respiratory illnesses. And I actually enjoyed listening to this conversation between these two wonderful conventional colleagues. But I must say that recommending nutrients to patients with coughs, respiratory illnesses, I think it's wonderful. Of course, we have tons of nutrients that are helpful for respiratory illnesses. It just seems to me that homeopathic remedies, they're selected with much more precision. So we're just not randomly throwing a certain nutrient at a patient. Or a certain number of nutrients. We are selecting a remedy based on a precise set of signs and symptoms. Keynotes, we call them keynotes, as you will see. So there's absolutely nothing random about homeopathic prescribing. Whereas nutritional prescribing for respiratory illnesses, I mean, let's say iodine, it may be highly effective in some cases. As a homeopathic practitioner, it just seems somewhat random to me. So here's a textbook, a book on how you can gain freedom from infectious diseases if you use homeopathy. It's a good resource. I'm just sharing a few books here that I've used over the years to help basically tackle these infectious diseases going around. These are just some book titles. Homeopathy for pneumonia. There's just we have so much to offer, even for pneumonia, believe it or not. It's like this book was written about 100 years ago by a medical doctor, Dr. Nash, and they were treating advanced respiratory diseases with homeopathic remedies back then. This is an extensive book written by another conventional doctor, Dr. Wells, on just the various rubrics in the repertory that have to do with fever. It's just mind-boggling to me how detailed this information is. Here is a book on treating tuberculosis, another respiratory illness, but that can affect the respiratory system by a conventional colleague. As you can see, a lot of these books are written by medical doctors, believe it or not, who happen to basically be homeopath. Yet here's another one. This one is by Dr. Dooley on how homeopathy is. You could think of it as a system of medicine where we're going beyond flat Earth medicine. Okay, so I'm a member of the American Institute of Homeopathy, which was founded in 1844, and here's their journal. It's a fantastic scientific homeopathic journal, and this is just something noteworthy. During the onset of the pandemic, we had numerous medical doctor homeopaths who are members of this institution who wrote articles on how these various homeopathic remedies were helpful to their COVID patients. These are fantastic articles. I just thought I'd point that out. Here's a recent video on YouTube I watched by Dr. Michael Frost, an internist from Vienna, who happens to be a homeopath. He's done randomized double-blind placebo-controlled studies on various serious conditions in the hospital, including sepsis, COPD, cancer. And since it involves COPD, I just thought I'd share this information with you. And here's a book that he's written. That's a fantastic video. I would highly recommend you watch it. You can see how conventional medicine in an urgent care setting can be combined with homeopathy masterfully. Dr. Michael Frost, this is amazing. So I know we're not this is beyond the scope of this, I guess, presentation, but in case some of you might be wondering, well, how does homeopathy work? Because I'm sure there are some non-believers in the audience. So homeopathy is basically energy medicine, right? And I just have that book in my office, and the title of it tells patients what we're dealing with, because patients are always asking, what is homeopathy? How does it work? Well, I just show them the cover of that book. I tell them homeopathy is a branch of energy medicine. It isn't a form of natural medicine. They're highly diluted and potentized substances that are found, for the most part, naturally found in nature. And everyone nowadays they know the word nanodose. So I just tell them these are just, you could say, nanodoses. These remedies are prepared with nanodoses of the original substance, and people get that. So here's just some extra information on homeopathy and how it's a wonderful branch of nanopharmacology. Dr. Ira Spell has done extensive research on homeopathy, and here's just some of the articles that she's written. And here's one where Dr. Ira Spell and Dr. Liana Stanish together, they put this fantastic article together, and they refer to homeopathy as of all the right here, they're saying that of all the traditional systems of medicine, homeopathy brings the most extensive experience in manufacturing top-down and possibly biosynthesized nano phytomedicines from members of many different plant species, plant families. This is a great article. I just love reading it. And here are many more articles by Dr. Ira Spell on homeopathy and nanomedicine. Recent PubMed article on homeopathy and upper respiratory tract infections. I thought that the conclusion was interesting, that they found that homeopathy was at least as effective as conventional medicine in treating URTIs. It's a recent article from January. So we covered that already. Acute coughs last 1 to 3 weeks, subacute 3 to 8 weeks. When you go beyond 8 weeks, you're talking chronic cough. Common infectious causes of acute coughs include the following. Common lung causes of chronic cough include the following. And here are some other causes of coughs. As you can see, some of these they don't have anything to do with the lungs, with the respiratory system. Like heart failure can cause a cough. GERD can cause a cough. Drugs like ACE inhibitors are notorious for causing coughs. Postnasal drip, which is sinusitis, that can cause a cough. Actually, it's a very common cause of coughs, is postnasal drip. Chronic cough has a high global burden, as you can imagine. Those are just some citations. We're talking extremely costly to the society, not to mention the psychological and social burden. Red flags for acute coughs. Please pay attention to a patient who's coming in with an acute cough and they complain of any one of those symptoms: chest pain, breathlessness, hemoptysis, which means throwing up blood, weight loss, fever. And if you don't feel comfortable taking on a patient with those symptoms, you need to immediately refer them to urgent care or emergency room. I have to say, I've treated patients with those symptoms during the COVID-19 pandemic. Homeopathy, again, just started the show. PND, an extremely common problem, post-nasal drainage. And yes, again, it can cause cough. A PND can cause a cough. And it's become extremely prevalent, especially since, I would say, the onset of Omicron. PND may result from COVID, it may result from allergies, it may result from sinusitis, and any one of those conditions, of course, could be acute or chronic, like acute or chronic allergies, acute or chronic sinusitis. I'd say even acute COVID versus long COVID, they can all cause postnasal drainage. And it's been my experience that many patients with PND are being misdiagnosed. Like a patient could come in with postnasal drainage and they're told they have allergies, and I, upon probing, decide that they have COVID. That's just a common thing these days. I mean, people come in, they're like, "Oh, I just have allergies. Don't worry, Dr. Sharif, you're not going to catch anything." I'm like, "How long have you had this postnasal drainage?" They're like, 3 days. I'm like, "How did it start?" Well, it started with a fever, chills, body aches. And I went to urgent care and they told me I tested negative for COVID. And they said it's probably allergies. I'm like, no, that's not allergies. That's an infectious condition. It started with fever and chills and body aches. So it's not allergies. So I have caught COVID from a lot of patients over the last 5 years. Thankfully, homeopathy always comes to aid. Okay, so mucus versus phlegm. Mucus is thinner, phlegm is thicker. And I'm sure you guys all know that. Mucus is produced in the upper respiratory tract. Phlegm is produced in the throat and the lower respiratory tract. So if you're coughing up anything, I call that phlegm. It's coming out of your nose, I call that mucus. So we already discussed that. I guess what's noteworthy here is that we have patients with overlapping respiratory illnesses. I spoke about overlapping diseases in my 2023 AAMP presentation. You can find that on both of my websites, which I'll have the references to at the end of this presentation. But yes, you could have chronic sinusitis with acute COVID on top, or you could have long COVID with acute sinusitis on top. I mean, it's just, you could have any one of these combinations. And how do you assess what's going on? How do you diagnose and how do you treat? In homeopathy, it's extremely straightforward. You treat what's in front of you. It doesn't matter how many layers you have. summary of that presentation that I gave on overlapping diseases is that you treat what you see, what's right in front of you, and then you go layer by layer. You remove the top layer, and then the layer below that, and the layer below that. You just keep going deeper. So that's noteworthy here. This is something I found on chronic rhinosinusitis on the internet, and what I wanted to point out here is that the researchers here, conventional colleagues, they're saying that epithelial dysfunction in these passages is basically an important characteristic of chronic rhinosinusitis. And in homeopathy, we correct dysfunction by directly improving function. So we're not giving an agent to a patient, a medication, a drug, a remedy that's anti-mucus per se, or it's anti-infectious, anti-inflammatory. We have remedies that just balance the tissues, balance the person, and by bringing harmony back to the person. So I couldn't help but just think that, epithelial dysfunction is, that's definitely, it makes sense that if you have a chronic inflammatory process in these passages, the epithelial layer is dysfunctional. Well, then how do you make it functional? I assume, conventional colleagues might claim that there are drugs that can do that. At least I'm not finding that in my office. A lot of our patients that are coming in to see us, they're not being helped by pharmacological agents when it comes to balancing the dysfunctional epithelium in the respiratory passages. Whereas homeopathy is far more likely to provide balance. That's what homeopathy is about, is to provide balance to our organs and tissues and the overall system. Homeopathic case taking. This is obviously not a short conversation or discussion, but I'm just going to try to highlight the basics and most important aspects of homeopathic case taking. Etiology takes precedence over totality of symptoms. So what causes an illness, it matters more to homeopaths than the combination of all the symptoms. So if a patient gets in a car accident and they are traumatized, and since the car accident they have a cough, you can ignore the cough and just give them arnica because it's our top remedy for trauma. So this is very important. If let's say a person has had PTSD, and since the PTSD, an event that traumatized them emotionally, they've been coughing, then you give them aconite, which is our top remedy for PTSD. And you don't pay attention to the details of their cough. So etiology takes precedence over pathology. Second, here we have what this slide is about is you pay attention to characteristic symptoms in homeopathy versus general symptoms. So what are characteristic symptoms? They are striking, unique, and unusual symptoms, strange, rare, and peculiar symptoms. Example, let's say a pulsatilla cough, a patient that has a cough that requires pulsatilla. They may say, my mouth is dry, but I don't want any water. In fact, I'm not craving any kind of liquids. So that's an odd situation. Dry mouth, yet no thirst. So that's pulsatilla. So we would give a patient is coughing that has that kind of a particular strange, rare, and peculiar symptom. We give them pulsatilla just based on that. So we're looking for weird symptoms here, characteristic symptoms. Character of the cough, of course, matters to all practitioners, homeopaths or otherwise. But in homeopathy, we get very detailed. My first question to cough patients is your cough dry or wet? Is it productive or non-productive? You could have a wet cough, have mucus in your chest, and yet not be able to bring anything up. I would call that a wet, non-productive cough. Many patients, most patients, I'd say, would call that a dry cough. Just because they're not able to cough it up, they just consider that a dry cough. And I correct them by saying, well, it's actually a wet cough, except that you're not bringing it up. So that's a wet, unproductive cough. The color of the sputum, of course, matters as well. Question 2, what's the sound of the cough like? If the patient is not coughing while they're with me on Zoom or in person, and by the way, most of our cough patients, unless it's acute, most of them are in person. But if it's acute, we just see them virtually. But if they're not coughing while they're with me, I have them record their cough when they do have a cough, and I have them send the sound clip to me. And these are just different words, you can I guess choose to describe various cough sounds like barking, rattling, whooping, wheezing. And this is a sample of the cough sound here. Okay, so is that a wet cough or a dry cough? Clearly, it's a dry cough. It sounds like it's completely dry. There's no mucus in anywhere to be heard. So you have to think of dry coughs, remedies for dry coughs when you hear a cough like that. So question number 3 and 4 and 5 and 6, basically we have this thing called in homeopathy called LSMC, which stands for location, sensation, modality, and concomitants. So all of those are important in homeopathy, in homeopathic case taking. The location basically is the origin of the cough. Sensation is the sensation. Like, does the cough feel dry to you? Does it feel, do you feel like a sensation of a lump in your throat? Do you feel pressure in your chest? Do you feel a sensation of heaviness in your chest? Et cetera, et cetera. Modalities are extremely important in homeopathy. Modalities are factors that can aggravate or alleviate symptoms. So if a patient says going by the window, opening the window up and breathing in fresh air makes my cough better, that's the modality we can use to narrow down the choice of the remedy. Concomitance can be extremely critical. If a patient says they have the typical symptoms of upper respiratory or respiratory tract infection, and yet they also have severe back pain, like 8 out of 10, that's a concomitant symptom that can matter significantly in selecting the correct remedy. There are 5 slides here that I have. These are just a list of questions I came up with recently that I wanted to share with you. I ask questions from this list, long list. And of course, I personally don't go down this list and ask all the questions. But since I know the remedies rather well for coughs, I just hone in on the right remedy or the questions that I need to ask to find the right remedy quickly. But in case it helps you to have a list of questions, these are the, I would say, compilation of a long list of questions that I've learned matter in homeopathic case taking for coughs over the last 2 decades. I've been using homeopathy for treating coughs. So you may benefit from looking at these questions. Okay, so should we recommend a constitutional remedy for a cough or acute remedy? Well, this is like the question of the century. So a constitutional remedy covers all the aspects of the cough, of the case, not just the cough, and often provides profound lasting benefits. Acute prescribing is more appropriate when acute symptoms deviate from the constitutional picture. I think that's like the best way I can put it. If the acute symptoms deviate from the constitutional picture. Let me give you an example. I had a phosphorus patient whose cough was no longer a phosphorus cough. This person's cough sounded like an antimonium tart cough, which we're going to discuss these later. So because the cough no longer sounded like a phosphorus cough, it actually sounded like an ant tart cough, giving that patient, even though the patient's constitution is phosphorus, giving them phosphorus wouldn't help the cough. Maybe if it did at all, it would be partial and not impressive. So I gave this patient antimonium tart, resolved the acute scanty rattling cough that antimoniums have. And then later on, when the cough changed into more of a phosphorus cough, I gave the patient phosphorus, and that was the end of her cough. So that's a good example there. There's like 2 other examples here I can share to discuss that subject of what do you do, constitutional or acute. Example 2, in this example, I'm going to focus on the whole idea that during an acute illness, the constitutional tendencies may flip. In this example, I'm going to talk about, let's say, a Lycopodium constitutional type, a Lycopodium person. They typically prefer warm drinks. And there are all kinds of reasons for that, but bottom line, they prefer warm drinks. But if a constitutional Lycopodium person develops a cough and they tell me that they really can't stop drinking cold water, and what does that mean? That means their tendencies have shifted. They're no longer in their typical constitution, in their core constitution. They're no longer presenting the typical Lycopodium symptoms. So then you have to think of a different remedy, an acute remedy. Craving cold water, coughing, I'm thinking phosphorus or bryonia. And then you ask further questions to figure out which one. Example three, this is a pulsatilla gal that told me that she took pulsatilla for acute sinusitis and it didn't help. And I asked her, well, what's the sinusitis like? And she had thick green phlegm that she was trying to cough out, but the phlegm was sticky in her throat. Thick, gooey, sticky phlegm, and it's green. I'm like, oh, that's an easy Kelly-Bic case. So I gave her Kelly-Bic 30C, 200C 3 times a day. And like the next day, I think her sinusitis was gone. Okay, so this is a rule I've come up with just for teaching purposes. I call it the 3 to 4-legged stool rule. So to find a remedy with some confidence, I just suggest tell my patients and students, we basically, the 3 or 4 main keynotes of a remedy have to match the patient's characteristic symptoms. Not the general symptoms, but characteristic symptoms. And just remember, the patient is a subset of the remedy, not vice versa. So when you read about, say, pulsatilla in the Materia Medica, a patient that you want to give pulsatilla to obviously does not have to have all the symptoms listed under pulsatilla. Even if the patient has 3 or 4 of the symptoms, especially those unique symptoms, like pulsatillas have dry mouth yet no thirst. And they are also, it can be weepy and kind of clingy, and they like fresh air. That's like four symptoms. If the patient has those symptoms, those are all pulsatilla symptoms, you got it. There's a good chance that you have a good remedy. Okay, is one remedy enough to address the cough? It might have been enough prior to the pandemic. I think it was actually, but since the onset of the pandemic, I'm finding for acute coughs, it's not uncommon for people to need 2 remedies back to back, not simultaneously, but back to back. And it's almost like as the patient's symptoms change, you have to think, oh, the remedy is changing. So at the first 2 days, they might have pulsatilla symptoms, so you give them pulsatilla. And the last 2 days, they might have some other symptoms, so you change the remedy. So you offer an appropriate remedy for each stage of the illness. And with chronic coughs, one remedy seems to be enough, thankfully. Cough in the repertory, there are many sections in the repertory that have to do with coughs. You can look at all that. I can tell you there are 590 remedies for just dry coughs in the complete repertory. So we clearly don't have a lack of remedies. And we have far more remedies than pharmaceutical medications for coughs. And these are specifically tailored for each and every case. Expectoration, there's a whole chapter in the repertory on expectoration with numerous rubrics. So an overview of the top cough remedies that I use in my practice, and I believe most homeopaths would probably have similar remedies in their bag of tools for coughs. So, and I've divided all these remedies to remedies for dry coughs versus wet coughs. Once in a while, you see some coughs are useful for both dry as well as wet. In fact, there are a lot of remedies that can be used for both dry and wet coughs. But predominantly, you're going to find that a remedy is either dry or wet. And even in dry coughs, you need to note some mucus may be present in the respiratory passages. An example would be the remedy bryonia. It's considered to be a dry cough remedy, but most bryonias that I have seen, they tend to have some mucus in the respiratory passages, some, not excessive amounts. So we consider that still a dry cough. So these are, I'm just going to go down these remedies fast. Aconite is, and these remedies are in alphabetical order. Aconite, when do I give that? When I have a cough with PTSD. I mean, just think of aconite because PTSD is, aconite is a top remedy for PTSD. Of course, the patient that gets aconite, they need to have many of the keynotes of aconite. You don't just randomly give aconite if the patient has PTSD. There are numerous remedies for PTSD, and there are numerous remedies for coughs. So you have to always look, does the patient have at least 3 or 4 symptoms covered by that remedy before you give that remedy? And those are the keynotes of the remedy. For each of these remedies, I've used different highlights like yellow, green, red. That's just to emphasize the things that are noteworthy. The colors don't mean anything. It's just there's no, I mean, I just randomly pick those colors. Of course, everything you see on each slide, they're considered keynotes. But of all those keynotes, the ones that I thought were more important, I highlighted them. So oscillococcinum, you all know that. It's a wonderful over-the-counter flu remedy. If the patient has those symptoms and they happen to be coughing, oscillococcinum might just do the job. Antimonium tart, one of my all-time most favorite cough remedies. I think of that when the patient has wetness, phlegm in the lower respiratory tract. It's definitely a wet cough remedy. The patient that needs that is debilitated because they've been coughing and coughing and coughing, trying to get that phlegm out, but they can't. It's like they have scanty production and they have labored breathing. All that mucus coats the inner lining of their lungs, so they just can't get enough oxygen in. And this remedy just dries up the mucus in the lower respiratory passages. And it's a phenomenal remedy. And sometimes you can hear the mucus rattling behind the chest in an antimonium case. Sometimes you can't. The mucus could be lower down in the lungs and you may not be able to hear it. But if it's in the bronchi and the bronchioles, you may be able to actually hear it rattle. The patient might even use that word. It's basically they try to get that mucus unstuck and they just can't, and that wears them out. Here is an antimonium cough sound. Huh. Okay. See, the patient was trying hard to get that up and out. And this patient in particular had been coughing like that for since the age of 10, and she's 70. So can you imagine for how long she's been coughing like that? And the antimonium tart 12C daily for a few weeks dried up all that mucus in her chest. And then later on, I switched to phosphorus when the nature of the cough changed, and she literally stopped coughing after 60 years of coughing. I have a lot of chronic wet cough stories, and antimonium tart just it seems to cure them. It's unbelievable. It just gets rid of this deep, chronic, wet cough. Here's another case. This is not too impressive. It's just a recent case. But what's unique about this case is that we had to jump from one remedy to another. I used 3, 4 remedies to get rid of her cough. And she has a terrible set of lungs. This lady, 60-year-old phosphorus person. A lot of phosphorus type folks, they have weak lungs. And so when they catch a respiratory illness, it takes a while to get them better. These are patients that can end up in the emergency room sometimes. But homeopathy saved the day. I work closely with her every day, and she was fine. You can read the details. This is a sound of the second patient I'm talking about. One night she had this deep, wet sounding cough. I gave her antimonium tart, and like within an hour, her cough turned dry. See how it's dry now. So it was wet earlier, but in 1 hour, it just turned almost too dry. So that remedy, antimonium tart, it just seems to dry up the lungs. Cases 3 and 4, these are more antimonium tart cases. A case of bronchiectasis of over a decade. She would cough all day long. So antimonium tart 12C daily, 2, 3 times a day. It like literally got rid of that. It just stopped all that mucus. It's unbelievable how effective it was. And she ended up having, I ended up insisting that she sees a pulmonologist for further workup at some point. When the cough was gone, she was still not quite right. So I said, something's going on with your lungs. It turned out that she had MAC, Mycobacterium avium complex, and she ended up on antibiotics for a few months, which I believe she needed. So, but homeopathy got rid of her bronchiectasis, and she went to a pulmonologist. I mean, once she went to the pulmonologist and she was recommended to take antibiotics, she didn't come back to me. She basically, and I insisted that she just works with a pulmonologist. I hadn't treated MAC in the past, so I didn't feel comfortable taking her on. So I just referred to a pulmonologist, and she's fine now. So homeopathy and conventional medicine together saved the day in this case. Case 4, just a simple antimonium tart case, coughing for a year, debilitated, cancer patient. I hear the cough she was sitting next to me at a gathering. I just, told her you should just go get antimonium tart from a grocery store and just take that once a day. And apparently in several days, the cough was either gone or much better. I heard from mutual friends, and I wasn't surprised. So this is a case of a patient, another antimonium tart case, 5 years of coughing, and this is her son's testimonial on how they were just so impressed. They had done conventional medicine. They're from India. They'd been to famous clinics in India, conventional allopathic institutions. They'd seen Ayurvedic practitioners. They saw naturopathic doctors here in Seattle. They did all kinds of herbs. Nothing touched it. Antimonium tart 30C daily. After a couple of weeks, she was like 80% better. And I believe it was completely gone in 2 months. But just the first few weeks, she was profoundly better. And at the end of the 2 months, I asked her to stop, and she was like, didn't want to stop. She was scared she was going to cough again and start coughing again. It was really cute. Coincidentally, now she has this strange skin. She's had this strange skin disease all of her life, and I gave her antimonium crudum to get rid of that. It's a very odd skin disease that no one has been able to treat, and it's already getting better with antimonium crudum. It's a very fascinating case. Um,
my
okay, so this is Bellotta. I think of that when there's shortness of breath and allergies, like mold allergies. Bryonia, genus epidemicus for COVID-19 so far. Dry, 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 left-sided, worse with movement. And you can see all the keynotes. I've probably given Bryonia to, I don't know, over 1,000 patients who were coughing due to COVID, and the remedy helped their cough and just basically reversed their case. We have a lot of testimonials by COVID and post-COVID patients that are on my website. So this remedy was the top remedy for the pandemic. And again, homeopathy is not for treating a particular disease. Is for addressing a combination of symptoms and signs that the patient is presenting with. So if the patient comes in, regardless of the diagnosis, if they say, I feel dry, my chest feels dry, I'm coughing, and I have a left-sided headache or left-sided body aches, and I don't want to move, I'm worse with movement, I think of bryonia. It could be flu, it could be the flu, it could be the COVID or any other disease. So we're going for symptoms. We're basing our remedy selection on symptoms, unless there's a clear etiology, in which case etiology takes precedence over pathology. Okay, carbo-veg, they call it a death reviver. It's when the patient is collapsed due to weakness secondary to either respiratory failure or heart failure. And they feel better with fresh air. They want to be fanned, and that's similar to pulsatilla and ipecac. Pulsatilla and ipecac also like fresh air. They go stand by the window. They want to go outside. But carbo-veg patients, they literally want a fan to be blowing air at them because they need that oxygen. Whooping cough. You can study the whooping cough here. In light of time, I can't afford the time to read every slide, but these are just some resources for you. Various sounds of whooping cough here on this website, very helpful. Coccus cacti is similar to antimonium tart and Kali bic. Basically, you're talking thick, ropey, copious mucus that can cause nausea and vomiting. The modalities are right there, better with cold drinks, worse with becoming heated. Corallium, profuse secretion of mucus, barking, rapid cough, great exhaustion. And one of the better remedies for whooping cough. And look at the modalities there, better with cold, better with artificial heat. Better with artificial heat. See, that's like the opposite of pulsatilla. Okay, Drosera, one of our top remedies for pertussis. I've highlighted the keynotes there. Just a cool story. I had a pertussis child in the office one time with their entire clan. And as soon as I entered the office in the morning, I heard the cough. It was like, I'll be right back. And when I got Drosera 200C, came in to the lobby, gave a dose to the child, it stopped the cough. Like we didn't even have to visit. It was a really simple. I could hear the violent, painful, dry cough, and they had the diagnosis of pertussis, and the child would vomit due to the severity of the cough. As soon as I heard pertussis and I heard the cough, I was like, oh, that's an extremely dry cough, and yeah, just Drosera just ended it right, like literally that, like he didn't cough from that moment forward. I mean, I believe overnight he was done with coughing. But at least during the few minutes they were at the office, I didn't hear a cough, and it was nonstop prior to coming in. Hepar sulf, great sinus remedy. Those are, you can read the keynotes. Chilly, splinter-like, sharp pains in their sinuses, worse with cold, severe pain in the sinuses, and you see the modalities. Ipecac, dry cough. They can gag too, like Drosera can gag. These people feel like gagging as well. They have a very, very clear, beefy, red tongue, and they can have incapacitating nausea, not relieved by vomiting. They feel like they're suffocating, spasmodic cough. better with fresh air, very similar to pulsatilla and carbo-veg. Notice there's a lot of overlap. So homeopathy isn't easy. Kelai the top wet, I'd say sinusitis remedy. I mean, there's just so much phlegm in the postnasal cavity. I think of it as one of my top most favorite sinusitis remedies of all time. Thick, dark green, sticky phlegm, and they constantly want to clear their throat. They keep going like that. It's just a caricature of a Kelai situation here. You have that thick, stringy mucus in the sinuses. Here's a sample sound clip you can listen to. There. He was able to get it out, whereas an antimonium tart would have a much harder time getting that mucus out. These are some blogs, a couple of blogs I wrote on the epidemic sinusitis we had prior to the pandemic. And I mentioned in those blogs how Kelai was and continues to be one of our top remedies for sinusitis. Here's a table that you will hopefully find helpful. This is based on 22 years of prescribing remedies for coughs, wet coughs. And I just decided that I need to come up with a table that summarizes the difference between these two remedies, because these are the top two most common remedies for wet coughs in my practice. Bic is for upper respiratory for the most part, upper respiratory coughs, and antimonium tart is for the lower respiratory. But then you can look at, compare and contrast the very different, the various aspects of coughs, or the various ways that these two remedies may differ. Okay, Kelai carb versus Kelai Bic. This is different. It's not Kelai Bic, but it's Kelai carb. One of the keynotes is back pain drives the pain. I mean, the back pain can be severe, and they have stitching pains. Notice back pain here is a concomitant symptom, right? It really doesn't seem to have anything to do with the respiratory system per se, but it is an important symptom. When the patient says my back hurts and it's 8 out of 10, and I have a cough, maybe the remedy is Kelai carb. You want to take the case and see if this might be an appropriate remedy. This actually, I ended up giving Kelai carb to my son who was coughing not too long ago. He had an acute upper respiratory tract infection. What gave away the remedy was his severe back pain. And he literally felt better that night. 1 dose of Kelai carb 30C. He was sick for like a few days, but Kelai carb 30C just took care of it. I love that rubric in Robin Murphy's repertories. You may want to take a note of that. Colds, it's called colds, common cold remedies. Phosphorus, an all-time top remedy for respiratory infections. It's similar to bryonia. They're both dry, they're both left-sided, they're both thirsty, but phosphorus can have nosebleeds, and also phosphorus can come with a burning sensation somewhere, usually in their chest. Up here, they say, oh, you know what? I just feel like I don't know if it's acid reflux or what, but I do have a burning sensation. Or they just feel warmer. Otherwise, they're similar. Hoarseness too. Phosphoruses can have hoarseness that I don't see with bryonia so much. Okay, pulsatilla. Usually they have thinner mucus versus Kelai Bic, which has thicker mucus. And with pulsatillas, ears are also often congested. They have a wet cough. So just remember the mouth is dry, but they're not thirsty, which is a strange, rare, and peculiar symptom for pulsatillas. They're better outside in fresh air. So you see pulsatillas usually always gardening, going outside. So if a patient has a pulsatilla cough, that's how they want to be outside, or they open the window. Rumex, when I see a dry, persisting cough, better with warmth, and they want to keep their mouth covered, they want to keep their head covered, they want to pull the covers over their head. Slightest inhalation of cold air triggers the cough, and they feel like there's a tickle in their throat. I recently needed that myself. I just wanted to like cover my mouth with my clothes, and very, very cold. And I had a tickle in my throat. It was definitely, it felt dry. And Rumex, 1 dose of Rumex just ended it. Spongia, extremely dry, our top remedy for croup. I'm going to play you a Spongia cough. That was me when I had COVID in 2020. Spongia 30C, one dose, just all of that stopped. Um, Unbelievable. It's a beautiful remedy, but just don't give it too much. 1 or 2 doses is all you need. Too much spongia can cause trouble. It's a powerful remedy. This is a sound clip of another spongia cough from the TV show Monk. You may want to listen to that on your own time. More sound clips of croupy coughs. Stanum, this is our last remedy. This is when the lungs are just basically collapsing for extreme weakness in the chest. I once had a phosphorus patient who had developed this cough, and phosphorus wasn't helping. And she came in, and I could barely hear her. Her voice, she had severe laryngitis, and she said her chest just felt weak. She actually said that, and she could barely walk due to chest weakness, lung and respiratory weakness. The Stanum completely turned her around. Like overnight, she said she got her voice back. She could walk. It was unbelievable. So we have these precious remedies that hopefully more and more of you guys will become interested in. Summary of the top remedies for coughs. Here's a chart I came up with. Hopefully you'll find that interesting, helpful. Other remedies, of course, there are tons of other remedies for coughs, like belladonna and Nox vomica. I just covered my most favorite ones. I don't usually see a belladonna cough, but patient presents with a flush face and a pounding headache and right-sided symptoms, you think of belladonna. So there are obviously numerous other remedies for coughs. I just threw in these two as some random remedies that you might see. Selection of the remedy and the potency, frequency of the remedies. This might be helpful to you, this slide. The sooner we treat, the better, obviously. This is extremely important here. You want to tell your patients with coughs that there's a good chance they will need more than one remedy. As if their symptoms change, they will likely require different remedies. So this is tricky. So if a patient has had a cough for however long and you give them a remedy, after 2 days, the nature of the cough might change. So they might need, say, K-Libic for acute sinusitis. But then once that's gone, if they're still coughing, you may want to take their case again, and they might need pulsatilla to wrap it up, like I shared, like McKinsey, the case that I talked about earlier. This is important. Prognosis after taking a remedy, you need to tell your patients that they can expect improvement within minutes to hours in the case of acute and subacute coughs. Minutes to hours. So within the first 5-10 minutes, if not within the first hour or two, they ought to experience an improvement. With chronic coughs, it might take a day or two before they're like, oh, I'm starting to feel something. But yeah, with acute, subacute, I'm talking minutes to hours. Sometimes the wrong remedy can help you find the right remedy. You give the wrong remedy and the keynotes of the right remedy surface. And that's interesting how that basically universe helps us. So even if you give the wrong remedy, and let's say the 30C dose of a particular remedy and it's wrong, the keynotes of the correct remedy like literally come up to the surface, then you can prescribe, you can see the right remedy manifesting in front of you, and then you can hopefully find the right remedy. Miasms, that subject of miasms is beyond the scope of this presentation, but those are just some important things to remember regarding miasms. In conclusion, in a world where new respiratory germs are continuously on the horizon, considering how smoothly and rapidly we homeopaths can often address various types of coughs, it has become increasingly relevant and often critical to incorporate homeopathy into our naturopathic practices or refer patients to homeopath. So please, if you have a cough patient and you don't feel comfortable treating them, you're not getting results, refer them to homeopath. These are the resources I use for this talk, for this presentation. And those are some of my AANP talks that I've given in the past. It can be found on both of my websites. And if you have any questions, you can email me directly to drsharif@drsharif.com. Thank you so much for attending this talk and listening to me. If you have any cough patients, please don't hesitate to refer them to a homeopath. We have treatments that help our cough patients, and it'd be a shame if you just send them to an urgent care when homeopath might have the answer. Thank you so much.